Welcome to the Health Admin Life podcast. My name is Brooke, and I'm going to interview special guests to explore the vast career opportunities in health administration. Whether you're a clinical professional, a corporate worker, a student, or a patient yourself, this podcast is for everyone. Get ready to be inspired. Hello, current and future healthcare leaders. Welcome to the Health Admin Life podcast. My name is Brooke, and today I would like to welcome Melissa Backmore, Enterprise Program Manager and Career Coach. Can you tell our listeners a little bit more about who you are?
Yes, hello. Thank you so much for having me, Brooke. So my name is Melissa Blackmore, and I've been in healthcare and project management for about 14 years now. I started my career as an administrative assistant in a large hospital and have worked in lots of healthcare roles, including certified nursing assistant, healthcare quality improvement. I've done healthcare mergers and acquisitions, analytics, operations, and of course, project management, which I found is my passion and really aligns with who I am and what I love to do. And I loved it so much that I decided to start a career coaching company, which has taken off. And so I've been able to help hundreds of professionals with their career journeys. And then just to give you an idea of my education, I do have a bachelor's in public health and a master's in health administration.
Thank you so much for sharing. I would love to know where you are now and your current position.
Yeah, so I currently work as an enterprise program manager for a healthcare technology startup that's funded by Microsoft. And so I run healthcare technology projects across the world. So we build and deploy software solutions for hospitals, primary care, and other types of health systems. And then, like I mentioned, I'm also a career coach.
That's awesome. And I think a lot of people in health administration don't know that there's so many different options other than working in a hospital. I know you work in tech and are a project manager. Can you elaborate on what that entails?
Yeah, so that is definitely a very common misconception, but what a lot of people don't see is that healthcare is so broad. So working in tech as a healthcare program manager, I'm helping providers, so care teams, doctors, nurses use technology to improve and streamline their workflows. So think about when you do a virtual visit with your provider, right? You're using some type of video platform. So that platform that you're using, those online forums, the entire workflow, someone has to go in and build that and make decisions around that. So that's where I come in. And the entire process of building out that application has to be managed by a project manager. And because I have that healthcare knowledge, I can talk to those doctors and those nurses and understand their workflow and understand the why behind why they need certain features and functions in their software. And so my job includes working between the providers and the people building that software.
That's great. How long would you say you've been in the industry for?
Yeah, so 14 years in the industry, and like many of us in healthcare, I thought I wanted to be in a clinical role. But after working as a certified nursing assistant, I decided that it just wasn't for me. And I decided to spend time really understanding what my skills and interests were. So I ended up in a data analytics role, and I honestly loved it. And that's where I actually met a project manager working in the same company. And I was working, so it was a community health center. And she was so awesome. And she just really had it together, and I saw a lot of myself in her and realized that I could work my way up to that type of role managing healthcare-based projects.
I think a lot of people can probably relate and are interested. So thank you for sharing. I would love to know what made you interested in this and how did you get to where you are today?
Yeah, so I definitely think it's important to play on your own skills, be strategic, seek out mentors and coaches, look for people who inspire you or have something in common with you, with what you want to be like. So the most important thing I tell my mentees and my clients is you will not be successful or happy unless you're in a role that you truly enjoy, you're passionate about, and aligns with your strengths. I realized early on that I love planning, I love process, problem solving, managing risk, but I also love healthcare. So I've decided to marry those two things up together and make a career out of it.
I completely agree with both of those. And playing off your strengths is really key, and it is strategic because if you have a goal in mind and using specific tactics to be successful, using those strengths will actually put you at advantage because you're doing things you love and you're good at, and usually things you're good at and enjoy, you'll have better success. So additionally, I would say even knowing your strengths is important, but it's not just to have a successful career, but to help accelerate others people's growth. My next question is, what is your favorite thing about working in healthcare?
Yeah, great question. So my favorite thing is knowing that my work is impacting patient lives. It's improving access to care for people who can't get to a doctor in person. They hop on a video call, they see the provider, and they get care. You know, it's really important to remember that you do not need to be in a clinical role. You don't need to be a doctor or a nurse to save lives.
I think that's completely true. Do you have any advice or insights for aspiring leaders going into health admin?
Yeah, so again, I think playing on your skills and strengths and doing the things that you enjoy, you'll make a bigger impact in the world if you're doing something you love and you're passionate about and skilled in. I also want people to understand that many skills can be learned. So for me, I actually had a major fear of public speaking, and I worked at it because I know it was a big part of my job, and I know I'm able to make a bigger impact by having good public speaking skills. And now I do public speaking every day. So, follow what your dream is, play on your strengths, and also work hard and grow every day.
I have the same fear. I am not great at public speaking, but again, it's something that I've had to work on. But this reminds me, and something that my mom always said is to follow my dreams. And I think if you're lucky enough to have that passion, you should try and achieve your goals, because you'll have the heart and you'll have the passion to make things happen. I think that people who have talent will do well, but having that heart and drive will take you so much further. You'll have a bigger impact and ultimately make yourself happy. Also, you will be working more than likely 5 days a week. So you want to be able to do what you love, and not only for the money, even though the money is nice. For our next question, if there is one thing you could improve in the healthcare delivery system, what would it be?
So I think access to care, a lot of us don't, and it's kind of plays on my last answer. A lot of us don't realize it, but access to care is such a big issue for so many people, especially those in rural areas. I think virtual healthcare can definitely help improve that. So ensuring people have devices that they need, so the laptop or the phone, to conduct the virtual visits. But also as a society, we need to do a better job to ensure everyone has access to the care. So for example, putting hospitals and clinics in areas that don't have them.
Something this also makes me think about, and with access, and it's not just about that proximity, but also the utilization and being cognizant of various generations and type of people using these devices. I think having patients at the first touch point and contact to get feedback as a stakeholder is crucial to being successful in these efforts to increase access to care. On that note, before ending the podcast, I wanted to say this has been wonderful, and thank you again for being a guest speaker. Is there a way that listeners can stay connected with you after the show?
Yeah, thank you so much, Brooke. So the best way to connect with me is either through Instagram or TikTok. So my handle on TikTok is @careercoachmelissa, and on Instagram, my handle is @careercoach.melissa. So please add me on there. I'm really good with answering, especially Instagram direct messages, and I really look forward to connecting with all of you out there listening.
Wonderful. And I want to thank all of our listeners. If you would like to listen to more episodes, check out the link in my bio at Health Admin Life on TikTok, Instagram, and YouTube. Today's show is brought to you by our sponsors, Riverside, and Anchor by Spotify.